Dr. Brittany here from Strathroy Wagner Chiropractic Health and Wellness Centers, bringing you my case of the week. This week's case is an athlete who presented to my office 6 months post-surgery after having surgery on the shoulder for a tear. The patient had been through pretty extensive rehab with physios and also an athletic trainer to get them back to their sport. However, the patient was still experiencing some pain when performing the sport and also some limitations in range of motion. In this case, did an assessment and determined that the patient had a lot of adhesions and scar tissue still in the shoulder. This was actually the patient's second surgery on the shoulder. And there was also some evidence of some impingement that was happening with overhead movements. So in this case, what I did was start with some shockwave therapy. So shockwave is a modality I have that is designed to break things up. It's particularly good at breaking up scar tissue and adhesions, so it worked in this case. And then I also adjusted the person's neck and mid-back just to make sure there was good joint movement there so that the shoulder had full potential to go to its end ranges of motion. We also worked on some of the muscles of the shoulder, doing some soft tissue therapy to them and some stretches. And then I also gave the patient a home-based rehab program with exercises for strengthening as well as some stretches to work on some of the muscles that were really tight still. After a couple months, the patient reported that they had no more pain when performing their sport and also had almost full range of motion back. And the patient continues to just see improvements in strength and is able to get back to performing their sport.